Let's now proceed to diagnosis according to Zhang organ patterns with the pattern heat blocking the pericardium. Pericardium and Sanjiao imbalances. There is often no description of Sanjiao patterns of imbalance in textbooks, apart from in those that use the diagnostic model diagnosis according to Sanjiao. The only pericardium pattern of imbalance that is usually discussed is pericardium heat in the diagnostic models, diagnosis according to the 4 levels, and diagnosis according to Sanjiao. This is because most authors consider the pericardium and heart to be very closely integrated, so they only differentiate heart imbalance patterns. Machocha in 2005 lists 6 specific pericardium patterns of imbalance, one of which is the aforementioned pericardium heat. Machocha argues that if there are symptoms and signs that can be related to the pericardium channel and its connections and the relationship with the chest, that is the lung channel and the renal channel, not only to heart organ symptoms and signs, we should diagnose a pericardium pattern of imbalance. Now let's go to heat blocking the pericardium. This is not something that we would normally meet in an ordinary clinical setting. When heat has penetrated down to this level, the patient will usually be treated with Western medicine and will probably be hospitalized. If the body is invaded by exogenous heat, the heat will initially affect the Wei level of the Qi level. In some cases, pathogenic heat can penetrate to the Yin level. The Yin level is the superficial aspect of blood. When the disease has penetrated this far down to the Yin level, it is deeper and more serious than when the disease was at the Qi level. Pathogenic heat can penetrate to the Yin level if pathogenic Qi is sufficiently virulent or if it is treated incorrectly or inadequately. Furthermore, pathogenic Qi can penetrate directly from the Wei level to the Yin level because the lung and pericardium both have their residence in the upper jaw. Pathogenic Qi will therefore be able to transmit directly from the lung Wei Qi for pericardium Yin Qi. Yin Qi is the Qi aspect of blood. Blood heat will agitate the Shen, which has its residence in the heart. This will result in restlessness and insomnia. The heat can be so intense that it creates phlegm. The phlegm and the heat will block and agitate the Shen, so the person may be delirious or raving, or they may lose consciousness. The heat will also injure yin. This is why the tongue lacks coating, the pulse is fine, and the symptoms are worse at night. There can be a rash or PTK because the heat has agitated blood, rupturing the walls of the vessels. Normally, the hands and feet would feel hot when there is so much heat present. This is not the case in this pattern, as the extremities are cold because pathogenic heat blocks the body's physiological heat from reaching the extremities. This is cold true heat, false cold. Even though there is intense heat, there is no thirst. This is because the heat is so intense that it forces fluids upwards in the body to the mouth. Now let's go to its etiology. This pattern will be due to an invasion of exogenous pathogenic Qi. For the symptoms and signs, there will be high fever that is worse at night, insomnia, mental and physical restlessness, no thirst, petechiae, red or purple skin rashes as in erythema and purpura, delirium and consciousness or coma. The skin feels hot when palpated, cold hands and feet, dark red, dry tongue without coating, rapid and fine pulse. The key symptoms, dry mouth and no thirst, high fever but cold hands, and consciousness, red tongue without coating. Treatment principle, drain heat from the pericardium. For the acupuncture points, we choose from pericardium 3, pericardium 8, pericardium 9, spleen 10, bladder 40, LI 11, do 14, and do 26. For the needle technique, we use draining and we bleed pericardium 3, pericardium 9, bladder 40, and do 14. For the explanation on the choice of points, pericardium 3, pericardium 8, and pericardium 9 drain heat from the pericardium. Bladder 40, LI 11, Do 14, and spleen 10 drain blood heat. Do 26 revives consciousness. A relevant advice. This is an acute pattern, therefore advice regarding diet or lifestyle is not relevant. The patient must be seen by a Western doctor. Heat blocking the pericardium can be caused by Wei Qi level heat or Qi level heat, and in turn, this can result to blood level heat. Thank you for your attention.